Hey guys, please watch my video till end because the quality content which I will provide you in or less than 3 minutes will be priceless and very useful to you. It might change your life, so I don't think you will skip my video. So let's start the powerful video. It can be unsettling to realize that you need to make an appointment with a gastroenterologist or gastrointestinal (GI) doctor. Before starting the video, please do not forget to like, share, subscribe and press the bell icon for new interesting videos. There is a good chance that your primary care physician has suggested that you consult with a gastroenterologist. How exactly do you go about locating the most qualified gastroenterologist who is suitable for your needs? 1. Ask for recommendations. Begin with the referral list that was provided to you by your primary care physician. You might also inquire for recommendations from members of your family and friends as well as from other medical professionals. Spend some time looking into the credentials and level of experience offered by the doctors on healthgrades.com. As you narrow down your options, you should call the office of each gastroenterologist on your short list and request a consultation appointment with the physician so that you can meet with them and ask them questions. 2. Do some research on the credentials of the gastroenterologist. When looking for a gastroenterologist, one of the most crucial factors to consider is whether or not they have board certification. Gastroenterologists are medical doctors who have completed further training and earned board certification in the specialty of gastroenterology. Board certification assures you that the doctor has the education, experience, and abilities necessary to give care for gastrointestinal conditions. Verify further that the doctor in question has not been the subject of any previous allegations of malpractice or disciplinary measures. 3. Take into account the experience of the gastroenterologist. When it comes to providing specialized medical or surgical care for complex gastrointestinal issues, the more expertise a doctor has, the more probable it is that you will have favorable results. Make sure that your gastroenterologist has completed a fellowship training program that is recognized and approved. Inquire with the gastroenterologist about the number of patients they have previously treated who suffered from your particular ailment. If you are certain that you require a particular procedure, you should inquire as to the number of times the doctor has carried out that procedure and inquire about the rates of complications, both those that the doctor has experienced and those that you yourself are at risk of experiencing. 4. Take into account gender. Because you will be required to freely discuss private matters with your gastroenterologist, it is vital that you are able to maintain a level of familiarity with the person's gender. Be sure to inquire about the gastroenterologist's recent training and experience, particularly as it relates to your ailment and your gender, and make sure to do so before scheduling an appointment with them. The treatment of women who suffer from gastrointestinal conditions is becoming an area of increasing specialization for gastroenterologists. In addition, certain medical facilities provide specialized GI centers that are tailored to meet the particular health requirements of female patients. 5. Conduct studies on the quality of hospitals. The hospital where your doctor works is also your hospital. As a result of this, it is important to think about the level of care that is provided at the hospital where the gastroenterologist can treat patients. The quality of the hospital is important to you since patients who receive treatment at higher-ranked hospitals experience fewer problems and have better survival rates. Additionally, you should think about whether the location of the hospital is significant to you. In the event that you require testing or treatment at the hospital, you want the location to encourage you to get quick care rather than discouraging you from doing so. 6. Conduct an analysis of your communication style. Select a gastroenterologist with whom you feel at ease conversing and who is willing to cater to your specific information requirements. Ask the doctor a question during your initial consultation, and pay attention to the response that you receive. Does he or she encourage you to ask questions and respond to your inquiries in a way that you can comprehend? Your response indicates if you felt rushed or engaged throughout the appointment. Find a gastroenterologist who is interested in getting to know you, who will take into consideration the preferences you have for treatment, and who will respect your ability to make decisions. 7. Peruse previous client opinions. It is possible to gain insight into how a doctor practices medicine and how his or her medical practice is run by reading what other people have to say about a doctor. In patient reviews, individuals often discuss their experiences with arranging appointments, wait times, the ambience of the office, as well as the kindness of the office staff. You can find out if patients have a good deal of faith in the physician, how much time the physician spends with his or her patients, and how well the physician responds to inquiries. 8. Be familiar with the provisions of your insurance policy. Your choice in insurance coverage is a matter of plain old common sense. It is highly recommended that you select a gastroenterologist who is a participant in your insurance plan. Doing so will allow you to make the most of your insurance benefits and keep your out-of-pocket costs to a minimum. When choosing a gastroenterologist from the options provided by your plan, you should continue to take into account qualifications, experience, outcomes, and the quality of the hospital. Like, share, subscribe and comment.